COVID-19 vaccine. How to get your child vaccinated against COVID-19. Children ages 12 to 15 are now eligible to receive the COVID-19 vaccine. The FDA broadened its age eligibility requirements for receiving the Pfizer-BioNTech COVID-19 vaccine to include this age group. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic, video posting every Monday and Thursday. To see my other videos, see the link at the end card of this video. As children return to school and in-person activities, there is an increased risk of infection from interaction with others. And while children are less likely than adults to experience symptomatic COVID-19 infection, there is evidence that the effects of the illness can be long-lasting and sometimes severe in children. Experts say the vaccines are the best tool scientists currently have to protect against COVID-19 infection and return to normalcy. Our children, after more than a year of lockdown, want to return to their normal lives. They want to hang out with their friends, they want to go to school, they want to see their grandparents, they want to do the basic things that kids do, like play sports without a mask on. The vaccines are safe and effective. The Pfizer trial indicated the vaccine was 100% effective and created robust antibody responses in 2,260 adolescent participants. Because the Pfizer vaccine uses mRNA technology, not live virus, it's not possible for your child to get sick with COVID-19 from the vaccine. The vaccine in adolescents appears to be very effective, even more so than in their older counterparts. During the Pfizer trial, there were 0 cases of COVID-19 among fully vaccinated kids. In addition to the various clinical studies in children indicating vaccine safety and efficacy, there are now several real-world studies indicating that they work well in adults. The children have the advantage of the adults being first to receive the vaccines, so we know a whole lot more about safety now because the vaccine's been rolled out to millions of adults. If you are a parent with children 12 to 15 years old and you're unsure about the efficacy and safety of the vaccine, experts recommend you reach out to your child's pediatrician or another trusted health provider to discuss your concerns. Navigating the conversation: people may be hesitant toward the vaccines for a variety of different reasons. When discussing the vaccine, it's important to meet people where they are. This is especially true when there are disagreements between parents and children about whether to get vaccinated. This is a listening exercise. I think the open conversation where you're listening to one another, and you are trying to arrive at the best decision, is really the best way to move forward. If you're on the fence about vaccinating your child, consider risk factors like the level of infection in your community, your child's medical conditions, and whether they will be attending school or other activities in person. When weighing these considerations, and especially when there is a disagreement between parent and child, it may be best to have a conversation with a trusted medical provider. A pediatrician or primary care provider who knows your family can offer updated and accurate information. Plus, it's important to remember that the decision to be vaccinated is a process rather than a singular event. As more information comes out about the vaccines, people's perspectives may shift. Preparing for your child's side effects, make sure to inform your doctor or nurse of any allergies your child may have. Especially if your child has a history of allergic reactions, be sure to wait for 15 to 30 minutes after their vaccination to monitor for any severe reactions. As is true with adults, it's likely that your child will experience side effects from the vaccine. These may include pain and swelling in the arm, tiredness, headache, chills, fever, and nausea. Studies indicate the side effects in 12 to 15-year-old are similar to those observed in 16 to 25-year-olds, with no evidence of additional or different risks. After vaccination, the child might not want to go to school that day. But those symptoms are mild and they're over quickly. Vaccines are best defense against COVID-19. The COVID-19 vaccines are currently the most effective method for preventing illness and stopping the spread of the virus. Experts say that immunizing adolescents will protect a large and important part of the population and bring the U.S. one step closer to herd immunity and a return to normalcy. Parents really need to weigh the risk versus benefit and remember that not vaccinating your child is not without risk. In fact, we do think there is greater risk of not vaccinating your child because those children are going to be more susceptible to disease. Kids want to get vaccinated. They are worried for their more vulnerable family members and they've sacrificed quite a lot to keep our community safe. Contracting COVID-19 is not without risk for these kids, and they want to protect themselves. For people who are interested in having their children vaccinated, pharmacies offer same-day vaccination services. The CDC says adolescents may receive the COVID-19 vaccine and other vaccines during the same visit, making it easier for children to receive multiple important immunizations at once. There has been very good momentum around parents wanting to protect their children and end the pandemic. Pfizer vaccine cleared for kids ages 12 to 15. Kids under the age of 16 are now eligible for a COVID-19 vaccine in the United States. On Monday, May 10, 2021, the FDA authorized the Pfizer-BioNTech vaccine for use in kids ages 12 through 15. The Expanded Emergency Use Authorization, EUA, was granted because Pfizer has demonstrated that its vaccine is well tolerated and 100% effective in the 2,260 clinical trial participants in this younger age group. Pfizer's clinical trials involving kids are ongoing and more data is to come. For now, the FDA has ruled that there's enough data to safely authorize vaccines for ages 12 and up, an important step forward ahead of the next school year. Having a vaccine authorized for a younger population is a critical step in continuing to lessen the immense public health burden caused by the COVID-19 pandemic. With science guiding our evaluation and decision-making process, the FDA can assure the public and medical community that the available data meet our rigorous standards to support the emergency use of this vaccine in the adolescent population 12 years of age and older. Is the vaccine any different for kids? Under the expanded authorization, kids ages 12 through 15 will receive the same version and the same 30 microgram dose of the Pfizer vaccine that adults receive. Like adults, they will need 2 doses spaced 21 days apart. Clinical trials are actively exploring the use of smaller dose sizes for younger age groups. For example, one Pfizer-BioNTech trial is currently testing low, medium, and high doses of 10, 20, and 30 micrograms in kids under age 12. Kids will experience vaccine side effects. Pfizer's clinical trial data showed that kids in the 12 to 15 age group had an even stronger antibody response to the vaccine than people in the 16 to 25 age group. But this did not make side effects any worse. According to the FDA, the side effects in adolescents were consistent with those reported in clinical trial participants 16 years of age and older. The most common side effects reported among 12 to 15-year-old lasted 1 to 3 days, and were more prevalent after the second shot. They included pain at the injection site, tiredness, headache, chills, muscle pain, fever, joint pain. Where can kids get vaccinated? Adolescents will be eligible to get a COVID-19 shot at any vaccination site that carries Pfizer. But in the coming months, they'll also be able to get a vaccine from their pediatrician. Currently, adults cannot get the vaccine at a primary care checkup because of the challenges it would pose for scheduling appointments and storing vaccines. We're working to get the Pfizer vaccine to more pediatric and primary care providers, especially because we want to make it easy for parents to get information, talk to the provider, and ultimately vaccinate their children. This is the first time that we are not just speaking to the individual who's getting vaccinated, but also the parent or guardian of the individual who is going to be eligible for vaccination. It's absolutely critical that they hear our messages. The Pfizer COVID-19 vaccine is now authorized for use in adolescents ages 12 through 15. This age group will receive the same vaccine dose as those 16 and older, who were already authorized to receive Pfizer's vaccine. Both Moderna and Johnson & Johnson's vaccines are authorized for ages 18 and older. In clinical trials, adolescents reported similar side effects to adults. Since becoming eligible for the COVID-19 vaccine, more than 600,000 children ages 12 to 15 have received the shot. Many parents continue to express hesitancy about getting their child vaccinated. Experts recommend speaking with a trusted pediatrician, pharmacist, or another health professional to make the best decision about whether to get vaccinated. Please like, share and subscribe to my channel. Thank you for watching. See you on my next video. Ma salam.